We're now going to talk about the Aero Bleed Kit, and we're going to look at the kit and also what's inside it. So to start with, you've got the label on the front, the information, and on the back you've got the contents of what's actually inside the kit. So one thing that's always worth doing when you're doing your regular checks is check that the kit has actually got everything in, just in case something has been taken out. So that's a very good reference for it. So to open up the kit, to have a look what's inside, first off it opens up. And inside you get all the components in there. It's worth making sure that you do know what's in the kit and make sure you do know how to use it. So we've got other videos on how to use all the items inside here. So what we're going to do now is have a look at the items in here, not in a particular order, it's just purely as they come through. So the first thing is a tag. Now the idea of this tag is it goes through the holes on here so that it's a tamper-proof tag. So if you check the kit and it's all okay, or it's arrived from you, you pop the tag on, and once you put the tag on, you know this kit has been sealed. So if this tag is missing, therefore the kit needs to be checked. This particular kit has also got a rubber seal around here, which is good to keep dust and moisture out. So next thing we look at is the foil blanket, a single layer blanket, very good to wrap someone up in. You can also use it with other items like coats or conventional blankets. And the idea is it reflects heat back to the body. Next one is gloves. The kit comes with nitrile gloves. Typically these gloves are in a large size because you don't want to have small gloves because you've got small hands, because then they're no use for somebody else. Whereas someone with small hands can always put a larger glove on. So the gloves usually keep those near the top because it's one of the first things you're going to need to put on. We then got some wound clot. Now wound clot is one of the new generation hemostats. Hemostatic agents will stop bleeding, but wound clot also helps to promote the healing cascade. So it's not only stopping the bleeding from the outside, but also from the inside. Once you put it onto a bleed, you can put this on any cut, or you can pack it into a wound. So it depends what the injury is. So if you've got something like a knife wound, you can roll it up and put it into the wound, and also on the outside. Slash wounds, you can put it on the outside as well. And it's a very, very good method of stopping bleeding. You've then got scissors. Scissors are used to cut away clothing to actually get to the injury site itself. So literally they're blunt-ended scissors, so they're safe. So you can cut away clothing and have a look. Make sure you expose the skin to see what's actually the injury is, but also just maintain to keep them warm, and also look at maintaining dignity where you can. Also has a tourniquet. This is the rapid stop tourniquet, which is a ratchet-based tourniquet. Very, very effective. You can put it on yourself, so you know the casualty can put it on. The key thing with it is pull it tight first, and then start working the ratchet up. And you need to put these on nice and tight. We've then got different dressings inside here. So we've got some standard HSE type dressings. And also a larger dressing in here as well. So these would be for smaller cuts, but one way you can make these better is to put wound clot on first and then put the dressing on. So you know, if these are not quite enough for it, but wound clot will help to stop that bleed to start with and make these much, much more effective. So they're the dressings with a gauze pad inside and then a bandage. In addition to those, you've got trauma dressing. So if there's a serious cut, this is really what you need. A trauma dressing is a much, much stronger dressing. It's got a much thicker pad. It's much easier to put pressure on because there's a lot more stretch in the bandage, and it's far, far simpler dressing to work with. So anything serious, then I wouldn't go for these much, go straight onto these dressings. And then the final thing in the bottom here is a chest seal. These are used for an injury where, supposing a knife has gone straight through the chest, but also it's punctured the lung. So you're going to see very, very bright red blood if that's the case, because it's very oxygenated blood straight out the lungs. And also you're probably going to see some bubbles in it as well. So the idea of the chest seal is that it allows air to escape from the body, from the lungs, but doesn't allow it back in again, and it can help avoid things like pneumothorax, which is a collapsed lung. Again, extremely painful and potentially life-threatening condition. So popping that on can be very, very useful. All of these items in here have got details on them. They've got the instructions on the front. Also, with every product in here, look out for the dates on them. So you're looking for the expiry dates of the products. So check all of them, because some of the dates, they're not going to be the same. No way can you have a kit with every single date exactly the same on it. So look for what the dates are. And then if you do use anything from the kit or something is expired, then get it replaced as quick as possible. If you go to use a kit and the dressings are out of date, use them anyway. It's not that. The key thing is we need to stop bleeding here. We do not want to be in a situation where we let someone bleed to death just because the dressing's out of date. It will be fine after the date to use if you've got nothing else to use. So with these kits, regular checks on them, check the dates to make sure everything's all okay, make sure it's not damaged, no water damage, things like that. But as a kit, this is a very good small kit, very strong. It's got all the components you need to deal with a catastrophic and life-threatening bleed. And make sure you site one of these in areas where you need them. So there's multiple ones on different locations on the site, because someone can bleed to death in just a matter of minutes. So you don't want to be running a long distance to get one of these. To try and get more of them around your workplace or community where you need them. And make sure that people within the community or within the workplace know where they are and they know how to actually use these.